approximately 73% of the community-based programs sponsored by HRSA in HIV and AIDS, and that the HRSA programs provide outpatient substance abuse services in HIV and AIDS clinics to over 31,000 visits. Those can be duplicated counts, so I won't refer to those as distinct individuals, but over 31,000 visits for substance abuse treatment. In maternal and child health, we have the Healthy Star program, of which there are 99 sites across the country. Those sites are providing case management, depression screening, and educational activities for women in areas of the country with high infant mortality and shortage of health clinicians. The Maternal and Child Health Bureau has also produced over the years the Bright Futures Guidelines, and these are periodicity guidelines. And since 1995, over 1.3 million copies of the guidelines have been distributed across the country, and they include an important chapter on drug and alcohol use and screening for youth. One program I want to highlight for the Maternal and Child Health Bureau, under the Affordable Care Act, they have now taken on responsibility for a new initiative, the Early Childhood Home Visiting Program, which allows states the opportunity to provide evidence-based home visitation services to improve outcome for children and families who reside in at-risk communities. This first year of funding, states are developing their plans, and this is a program, I believe, that affords the opportunity for states to develop the kinds of home-based screening and referral for treatment in behavioral health services that I think will be very important. I want to touch for a minute on the National Health Service Corps program. That's a program which, under the Affordable Care Act, has gotten a big boost in terms of their ability to place recent graduates from medical and nursing programs and in behavioral health disciplines in communities all across the country in return for loan repayment for their training and education. Currently, more than 7,000 National Health Service Corps clinicians are working in underserved areas across the country, including over 1,000 who are providing behavioral health services in disciplines such as psychiatry, clinical psychology, clinical social work, licensed professional counselors, etc. And 20% of the behavioral health awardees are engaged in substance abuse delivery services directly. Also, just to note, over 80% of those scholars who are placed